So my name is Kwamile Idarasid Ogunjemite, and I am the Executive Director of Cardinal Healthcare Foundation. And I'm a development consultant, primarily in healthcare. So I definitely enjoy working to promote health equity in different ways. And one of those is by ensuring that healthcare is affordable. So when my friend Taiwo told me about her experiences when she was having a baby, her first child recently, and said, okay, company, I think we should do something about healthcare insurance awareness. I thought, yes, definitely, Taiwo. It's something that we needed to do. So I was so glad to say, okay, let's put these events together. Let's try to spread more word about healthcare insurance, especially for businesses and entrepreneurs. And that's why we are here today, because we think it's very important to make everyone more aware about how healthcare insurance works, both for individuals, for businesses, for and for families essentially. And we are not here alone today. We are joined by powerful people from both the private and the public sector. We are joined by the public sector engagements lead as well ahead. Yes, you can do here. You can give some virtual applause and all. And then we also have the enrollment manager from the National Health Insurance Authority, one of the leading organizations in health insurance, especially public sector in Nigeria. So yes, thank you, Bolo Stife, for that virtual clap. And of course, my friend, the founder of Quotidian-V Foods, is on the call in person of Taiwo Kent herself. So welcome, Taiwo. Welcome, Julius. Welcome, Ajibola. It's such a pleasure to have you here today. So to get into it, I like to gauge the knowledge about what people currently know about healthcare insurance. So I'm going to start with a very little quiz. So thank you, Julius. I see you're here. So I like to start with a very quick quiz, just to know and gauge the knowledge of people in the room. And also to emphasize the fact that today we're not just here to teach you about healthcare insurance. Three people are going to be leaving this call with a 1-year health insurance plan. Please, if you're excited to hear that. Yeah. And that's sponsored by Quotidian-V Foods. So I'm particularly excited about that because it's not just enough for you to know about health insurance. It is important for you to also have health insurance. And I'm going to get you started. But to qualify, make sure that you are registered for this webinar. Make sure you didn't just join like through the Google Meet. So Ade Damola, kindly
All right, good evening, everyone. Hi. I think Family is having a bit of a network issue, but I'm sure she's going to join back. But in the meantime, kindly use the link in the chat box to register for this webinar if you have not registered, because we'll be using people that have registered, we'll be using that link to pick our winners for the health insurance. Thank you. So we'll just wait for Family. Damola, have you dropped the link? Damola, please confirm that you have dropped the link to the form. All right. Thank you, Bolu Atife. Good evening, everyone. Can everyone hear me?
Yes, we can hear you, Carol.
All right, so sorry everyone. Can you hear me?
Yes, ma'am.
All right, can you hear me now? So sorry about that. My network is definitely misbehaving, and I'm not sure why. And even though I have put backup in place, it's like my backup wants to join. But kindly pardon that, please. So I was saying again that I'd like to start the session with a quiz. Thank you, Bobatifе and Taiwo, for stepping in while I was away. So I'd like to start with a quiz, just gauge the knowledge of people that we have in the room, and I'm going to be sharing my screen now for us to I'm going to be sharing my screen now for us to get started. So we're just going to be responding in chat. This is not what determines who gets the healthcare insurance we have for you, right? This is just basically for us to have an understanding and so that our speakers too can gauge the knowledge of everyone. So let's get to it. Are you ready? Are you ready? So please, I want to be reading our chat in the chat room. Okay, so the first one is, what does HMO stand for in health insurance? Many people have heard that word HMO, but what do you think HMO stands for? Is it health maintenance option? Is it health management organization? Is it health maintenance organization, hospital medical office? So just simply comment A, B, C, or D in the chats. Kindly just A, B, C, D, or A, B, C. Okay, B. Someone said health management organization. All right, thank you. B, Moyolua also said the same thing. Thank you, Rachel. Thank you, Moyolua. Who else is giving us a response? What's the full meaning of HMO? Okay, all right. So let's see. Health maintenance organization. Thank you, Blessing Esther as well. And that's very. Wait, did somebody say health maintenance, health management, PDB? Rock to the rescue. Okay, all right. So actually, our answer is health maintenance organization. So they are so similar, so don't mix this together. There is health management organization and there is health maintenance organization. So we have Adesola and Monyolu are going for health management, but the full meaning of HMO is health maintenance organization, and that's option C. All right, thank you, let's take note of that. Then let's go on to the next question. Which of the following is not typically covered under basic health insurance in Nigeria? So again, just drop, is it malaria treatment, emergency surgery, spa services, childbirth? Which one is like usually not covered under health insurance in Nigeria? Let's keep the answers coming. Rachel, what do you think? Monyolua. Thank you. C, I can see C. Spa services. All right. Blessing is on the screen. Which of the following is not typically covered under basic health insurance in Nigeria? All right, thank you. So most people are going for spa services. All right, and that's correct. But although I have to let you know that it depends on what you are paying for actually. Some HMO packages might be able to give you spa services option. Let's say you're paying up to like, okay, I don't know, but like let's say you are paying 500, 1 million in a year, right? You might also have maybe one spa service, one spa session, two spa sessions in a year. But generally, the other ones are more essential than spa services in most HMO services in Nigeria. So let's go on to the next. Health insurance only benefits who people who fall sick frequently. Is it people who fall sick frequently or not? Is that true? B, false. All right. Monyolua says that's false. Okay. True or false? True or false? Thank you. More responses. False, false. All right, false. All right. In fact, probably one of the things we're going to talk about today is, some of the moral hazards of insurance, right? The fact that some people, because they know they fall sick regularly, and then because maybe they have already been diagnosed of a condition, then they go to go and get HMO without disclosing it like earlier, right? So these are some of the moral hazards of insurance. But generally, it's for both those who fall sick often and those who do not fall sick frequently. So anybody can actually use health insurance. Okay, the next question, let's go on to the next question. About how many percent of Nigerians have any form of health care insurance? And I think this one is very important. How many people do you think are covered in Nigeria? Option A is like 50 to 60%. Option B says 5 to 7%. Option C, 20 to 25%. And option D, 70%. So this is like a cumulative of both public and private. About how many Nigerians do you think are insured? Okay, so Omoni Jeoluwa Pelumi says that she thinks 20 to 25%. Great. More responses. Do we have responses on YouTube too? Okay, option C, Blessing Esther thinks the same. Please, there are a lot of people on this call. Let's keep the messages coming in. Please, let's keep it coming in. Moyoluwa also says C. I've been seeing responses from Moyi, Esther, Rachel. Okay, Rachel thinks A. Should I call other people's names? I'm looking for more responses, please. I'm looking for more responses. Adedamola, what do you think? Adedamola, what's your answer? Miracle, what do you think? Emmanuel, what do you think? John, what do you think? Shegun, what do you think? Right? Okay, C. Thank you. So I have a lot of people going for C, B. Oluwayomi says she thinks about B. And Oluwayomi, Emmanuel, okay, all right. So let's go for the answer. Damola also thinks B. The correct answer is B. You may feel disappointed, but I'm just as disappointed. Maybe the two of us are both disappointed. But yes, we have just about 5 to 7%. Okay, let's say average like 5 to 10% of Nigerians altogether important it is for us today to actually talk about this topic. It's just about 5 to 7%. So the very last question we are considering before we open the room to our guests, which should be led by Taiwo. Is this true or false? You must be employed in the formal sector to access health insurance in Nigeria. Must still be employed in formal sector or informal sector or either. What do you think? False. All right, thank you, Moi. False. I can see the false coming in, and that's very true. That's very false. You do not need to be in the formal sector, but sadly, most people that have health insurance are people in the formal employment. The informal economy is still yet to really key into healthcare insurance in Nigeria. So thank you so much, everyone, for participating in that quick quiz, and thank you. I trust that you have learned one thing or the other from that. So I'm going to be handing it over to my co-host at this point. I hope I haven't eaten too much into our time. I think I'm just on point, apart from starting about 5 minutes behind schedule. All right. Thank you, Taiwo. I'm handing it over to you now to kindly lead us into the conversation and introduce our guests.
Hi, thank you. Good evening.
Thank you. I see the claps. Thank you.
I'm so glad to be here tonight, really. I would say it's like a dream come true. And a section that was that came out of a place of concern, out of a place of interest, and let me say a place of purpose, really. So my name is Taiwo. I'm Taiwo Kent. and founder of Quotidian-V Foods. And what we do at Quotidian-V Foods basically is that we are focused on, let me say, we are contributing our own quota to people's good health and well-being. So that's just the summary. People's good health and well-being. Though we do this through providing 100% pure natural bee products. By bee products, your honey. Thank you. All right. So, we do this primarily through providing pure honey, bee products, or your honey, your wax, your propolis, your royal jelly, and the likes. And we've been doing this for a while, actually. And I'll tell you the origin of this program. So I enrolled with all right, I'll say my mother in the Lord, Pastor Mrs. Funke Adebayo. I don't know if she's on this call. A mentorship platform, and then we had these assignments that we had to look inward to our concern and do something about it, really. And one of my concerns was the experiences I had last year. I'm going to tell you briefly about the experiences. And I felt, oh, this is actually a concern to me, and to do something about this. And that is what started the idea for this program, right? So I throughout last year was, let me say, my pregnancy period, because I was pregnant last year, March. Then I started antenatal, so I've not really been frequent to hospitals. Like, of course, we do our quarterly check, medical checkup, but then when you have to now go for antenatal every 2 weeks, you see things, you hear things, right? So I started hearing things about, then they have to, I could remember a particular day during our antenatal where a woman was supposed to see gynae. We used to do routine check, ultrasound check, and all of that. And they discovered this woman, she needed urgent. In fact, they needed to admit her, and she needed to see me and all of that. But she said, oh, she will come back. So the nurses have to probe and say, why are you coming back? Why not? She said, oh, she does not have. Then they will have to be admitted, and that, so that she doesn't even know. Okay, we have to. And to see a gynae then at the clinic, it's 10,000 naira. Or let me say, it was 10,000 naira. I don't know if it has changed now. So it was 10,000 naira, and she couldn't afford it. So we had to, rally around, all of us, and it's only the person that has 1,500, all of that, and gather the money for her to just see the gynae, so that they were able to, by gynae, I mean a gynecologist, and so that she'll be able to check, or the gynae will be able to check her and see what's going on and know the next process. I was concerned that, okay, so there is actually people who could not really afford 10,000 to see a doctor. Afterwards, I came by another woman who happened to be one of my students. I train people on beekeeping and the likes, and she said that, she has not been coming for training. I asked why. She said, because our family, that like 4 of them got sick at the same time, and they were actually taking injection, but they could not complete the injection, and they had to resort to apps and all of that around. I was like, okay, how many days is injection? She said 5 days, and she said one injection was, is it 1.5 or 2.5? I can't remember, something of such. I was like, okay, so for 4 of you, that means she had to, per injection, she has to spend about roughly 10,000 naira plus transportation. And they have to do that for 4 days, meaning they have to spend like 40,000 naira to be able to get their treatment. So experiences like that got me thinking and concerns, because I felt if those people had knowledge about health insurance and all, then I started asking people questions. Do you have HMO? Do you use HMO? Many people say no. And people now say, and I said, why? If I ask them why, they will say because they are not a government worker. stuff like that. And I was concerned. I said, okay, you are not a government worker, doesn't mean you cannot. You know, I started educating people because really I've experienced HMO. By that I mean health insurance schemes. I won't mention the name of the HMO I use because of course it's not a paid this thing. You can use anyone. And I know the benefits. Like now, I get my eye checkup every year. I do twice in a year to get eye checkup, dental checkup, all of those checkups. So you don't have to be sick before you go to the clinic. But then because people do not have free access to medical plans, they go when they are sick. So that's happened to be a very much concern for me. So that is why this particular program, that's one of the reasons why it's coming up, so that we can learn and know that even as an entrepreneur, as a freelancer, as a business owner, even your workers should have a plan. So there's a package for workers. So let's say you have 3 people in your company. You could, even if they're earning the minimum wage, right, or even less, there's actually a plan for them, you understand? And you know how to deduct. It's not something that will break your bank. And we have people here, our speakers, who are going to shed more light on this, how to go about this, the plans for small business owners, the plans for individuals, for freelancers. So you don't have to say because you are not working in an office, in quotes, then you don't have to have access to health insurance plan. Imagine you having like let's say 70,000 naira per year plan, and you have access to up to like 500,000 naira worth of health care. That is fantastic. So why are we not talking about this? Why are we not doing this? So this came from a place of concern, and that's why we are holding this program. Right. So thank you so much for joining. And I will go right about to introduce our speakers. Sincerely, the speakers are also, they are doing this from a place of concern and a place of helping people genuinely. So feel free to listen and to ask questions. So we have here our own very Oga from the NHIA. So NHIA is the national. Sorry, 1 minute. The national 1 minute. So the National Health Insurance Agency, and this is a federal ministry, is a federal government owned. So like that's like the boss. I'll call them the boss of all of the insurance company you can work with. So we have here one of the recruitment managers, Mr. Ajibola Temitope. Can I have Thank you. You're already doing what I want to say. Please, can you have a virtual round of applause for him, Mr. Ajibola Temitope? Thank you so much. I will call the full name, Ajibola Temitope Olariwaju. Thank you, sir, for joining us tonight. And he's going to give us insight on, from his own field, his own company, let me say, from the federal agency company, that's the NHI. We hear NHIS. Actually, okay, yes, the board name is NHIA, which is National Health Insurance. So we have also we have our guest from Wella Earth. These guys are doing fantastically well, and we have Julius. Please permit me if I'm not pronouncing this well. I'm so sorry. We have Julius Obomokai. Oh my God, I'm so sorry. I don't even know how to pronounce that. But yeah, we have Mr. Julius, and he's the lead public sector engagement officer at Wella Earth. Is the head of the engagement is the lead engagement officer for Wella Health, and Wella Health is a foundation, right? They are a private insurance company, and is very interested in public health. Like I said, our speakers are those who have genuine hearts for people's health and well-being. And interestingly, Wella Health, because of the good job they're doing, got grants from African Business Hero. Even know what African Business Hero means? That means it's a grant not just for Nigerians, but for Africans and all African countries. And came out together, and I think they chose like 3 winners, and they emerged as one of the winners. That's fantastic. That shows you that they are really doing something of global concern, of global interest, right? Yes. And slaves, they won this twice, I guess. So they are really doing well in their. So we have Mr. Julius here, and he's going to do justice to his own section as well. So make welcome with me our very first speaker, our very, very own Oga at the top, at the federal level. We have Mr. Jibola Temitope. Thank you so much, sir. You're very much welcome. The floor is yours, sir. Thank you. Sir, you are muted. It seems you are speaking, but it's like you're muted.
Yes, please kindly unmute the mic. We can hear you.
Can you hear me?
Okay,
Yes,
yes, we can.
Okay. Good evening, everyone. I am Majibola Olaritimitope. Like our madam has just said, I want to say that I'm really happy to be part of this discussion. I'm highly honored. It is very important because going by the population of Nigeria and the mindset that people have towards health insurance, it is very important to further enlighten Nigerians about the importance and what they stand to benefit if they key into any form of insurance whatsoever, either private or government health insurance program. I once again want to appreciate the speakers that have spoken earlier in the persons of Mrs. Pamela and Mrs. Taiwo for doing a wonderful job in laying a solid foundation to this important discussion. I also want to correct and Ms. Pamela that our organization is not actually agency, it is authority. Permit me to make that correction. National Health Insurance Authority.
Okay, so I think we can hear Mr. Jibola. I would like to confirm if that's from my hand.
Insurance, what insurance entails. Insurance is just a way of contributing into a pool different people contribute a certain amount of money based on their ability or an agreed amount into a particular pool, and that pool will be used for the benefit and betterment of all the participants or contributors. In this case, we are talking about health insurance. Creation or establishment of health insurance dated back to 2009 under the then President of Nigeria, Olusegun Obasanjo, when he established the scheme for the essence of ensuring health insurance coverage to all Nigerians. All Nigerians, irrespective of your background, your religion, or whatever you believe in, you must be covered. And ever since then, we have been rolling out so many programs to ensure that all Nigerians are covered. Initially, the program was designed to cover federal workers. Federal workers, that is, those that are working under federal government. But as times went on, we discovered that it should not only be limited to federal workers. People who are not under federal government should also benefit, as long as they are Nigerians. So we now started having different programs. We rolled out programs for the aged, the children under 5, the pregnant women, and so on and so forth. These are wonderful programs that Nigerians can partake in, apart from federal government workers. Now, there is certainly an amount of money that is being contributed into a pool that people can benefit from. I will first start from that of the federal workers briefly. The program for federal workers is called Formal Sector Program. Formal Sector Program. This program is designed for all federal government workers, and certain amount of money is being deducted to my wife and 4 children that are under the age of 18. Anytime they are fall sick or they need to seek medical attention, they go to the hospital and they don't really pay much. They pay practically nothing. What they only pay is 10%, we call it a co-payment. For instance, if a drug of 20,000 naira is being administered or given to them or to me, I only pay 10%. It is called a co-payment, which is 2,000 naira. The remaining financial burden will be borne by the federal government, that is NHA. Where is that money going to come from? The money will come from the pool, what we contributed into the pool. So health insurance is not free, though it is accessible and it is affordable. Government is subsidizing. On a yearly basis, federal government has certain amount of money that is going to that pool to make it easier for people that are accessing care. That is on the aspect of federal government workers. On those who are not working with government, we have private businessmen, entrepreneurs, we have religious leaders who want to enroll their members, the apprentices, the students, all categories of people. This is called informal program, informal sector. Now, the one that is very popular, we have a lot of them. Some are not popular. They are not popular not because they are not important, but because there is not enough fund to actually finance these programs. Because health is not actually easy to finance in a country like Nigeria, where health is not prioritized. You agree with me that the federal government of Nigeria is not actually giving enough priority to some sectors in Nigeria, and health is one of them. But we are trying to say the facts. Now, under this program, you have what we call giftship. Giftship is an acronym. G
So sorry. I think Mr. Jibola is having a lot of network interruptions as well. But let's hope he's able to reconnect as soon as possible, or we might just have to
that one is
come back.
also going
Okay.
on one side for state government workers. If time permits me, I might even go into that also because I was there when they launched that of Ogun State with the current governor, Dakwa Abiodun. Now, I'm talking about giftship now. Anyone, whether an entrepreneur, you are a private worker, you are dead, irrespective of what you do, you can come under this program, giftship. The first one is individual. Recently, the premium or the price for accessing this health insurance package is 117,000 naira. 117,000 naira for 3 people. Please don't get it wrong. This program is designed for one person. One person that wishes to do it alone will pay the same amount of money, 170,000 naira. If there are 2, they pay the same amount of money. If there are 3, the same amount. And I break it down. The recent price was increased this year, April 1st, from 66,000 to 117,000 naira. Initially, it was 15,000 naira, and the program was on that amount for up to 9 years, 15,000 naira. That is, you can easily walk into our office You pick up a form, you fill a form, and you just pay 15,000 naira, and from there you start enjoying health benefits after 60 days. The waiting period then was 60 days. Now, you mentioned something while speaking, Ms. Pomile, like moral hazard that are attached to health insurance. Now, we call it adverse selection. That's our own terminology, adverse selection. Now, we notice that for about 8 or 9 years of this program, a lot of people will have gone to the hospitals. They will have been diagnosed of some ailment that will cost them like 500,000 naira, 700,000 naira, even up to 1,000,000 naira. Now, where do they get it? They get the money. Most of them will not even have that money at that point in time. They will now rush to NHIS, then NHIS, to come and just for just 15,000 naira. I hope you are following. So they will just come and just purchase it for just 15,000 naira. And after 2 months, they will go to that hospital, they go and carry out that surgery or whatever they want to carry out for just token of 15,000 naira. And this kept on going for years.
Okay, sorry once again about that.
Attached to it. One of them is the waiting period that was initially 60 days was increased to 90 days, just to address that adverse selection. Not only that, the money, the fee, which was 15,000 naira, was increased. That was the first time they increased the money, and that addressed it slightly. Even despite that, people were still coming in to take advantage of the program. So in the long run, they increased the money from 45 to 66,000 naira. And at that time, they attached another condition that anyone that wants to take part or that wants to use that program for any surgery, any major surgery, the person has to wait for at least 6 months. For instance, if you register today, this is July, and you wait for 90 days, after your name must have come out, we inform you your name is out. If you want to use the program for surgery, any form of surgery, you have to wait for 6 good months before you can access that program and use it for surgery. And this addressed a whole lot of adverse selections, because right there in our office, so many people have walked into our office with the hope of using this program for major surgeries. But when they hear that 6 month conditions, they turn back, because that 6 months we cannot really, it will not really work with their own plan, with their own program. So it addressed that aspect, and that is why the price also was increased again from 60,000 to 170,000 naira. This time around, to ensure that our services, we deliver better services to enrollees. The people that are registering under us are called enrollees. That is terminology.
All right. Thank you so much, Mr. Jibola. The network is breaking from your end and we can't hear you quite well. And so we'll just come back to because we're going to have like a quick Q&A. Hello, can you hear me, sir? Yes. So sorry, the network. Yes, the network was breaking from your end a bit. But let me quickly go on to Mr. Julius so that we can come back again for a Q&A question. Then hopefully your network will have been better by then. Thank you. But we're definitely enjoying the way you're breaking it down for us. It's been so informative so far. Yeah, thank you.
Yeah.
All right. Thank you so much. And we're going to be about this time also, we're going to be yeah. We're going to be hearing from Mr. Julius, who is going to also tell us more about what how Wella Health does its own healthcare insurance. Actually, Wella Health is more of a health tech company than health insurance company. But one of their products is the micro insurance, which is actually quite unique in how they deliver their own services. So I'm going to be handing it over to Mr. Julius right now. Hi, Julius. Are you on the call? Can you hear me clearly? All right. Okay. I like the fact that people are clapping already. Thank you, Moniolua.
Hello. Hi.
All right. Hi. Can you kindly take us through Wella Health insurance, micro health insurance package, and also kind of speak to us how beneficial it is for entrepreneurs and why entrepreneurs of different skills should get on board health insurance for them and their staff. Thank you.
Okay. Thank you so much. I hope my network does justice to this. I mean, the network thing is a general issue. First off, let me say well done to my Oga, Oga Jibola. They are our NHI, they are our people. Yeah. They are the chief regulators of anything insurance in Nigeria. So let me give honor to whom honor is due. Well done, sir.
Yes.
Okay, so my name is Julius. As you've heard, I lead the public sector engagement at Wella Health. I've been listening to Gajibola speak, and I just thought that it's all, before I delve into how businesses could key into health insurance, that it's just best to really just brush on the whole concept of insurance. From experience, I hear this every day. People say insurance in Nigeria is a scam. That's why they don't want to be part of anything called insurance, health. It's a scam. And for somebody like me, that's not just because I'm in the sector, but I'm a big beneficiary of insurance. I tell them it's not a scam. Insurance, simply put, is I give you 10 naira. Hold this 10 naira. In case, the key word is in case I have need for XYZ, as spelled out on the contract, I will come to you for you to attend to me. So if nothing happens within that period, you that have collected my 10 naira, you go and dance and you are happy. But when I come back and say, Oga, that 10 naira, something has happened, oh, please, I need you to help me. You are duty bound to provide that service. So at the end of the day, when you look at the concept of insurance, you, the enrollee that is paying for the service, you are the one cheating the insurer, because that money you have paid is not enough to cover for what you will come and ask for tomorrow. However, the insurer is taking the big risk by saying, don't worry, give me this, your 10 naira. Don't worry, I have you covered. Anything that happens, come to me and I will attend to you. Right? So I just need us to understand what insurance is, so that it's very, so that when we are listening to myself and Oga Jibola, you would be able to key into the insurance concept and know why you should get, an insurance plan for yourself and for your children. So nobody's cheating you. You are the one cheating the insurer, right? So for the insurer, you ask yourself, how does the insurer make money? The insurer make money by coming to you to give him the 10 naira and hoping that 100 or 100,000 more of you will give him that money. So anytime you want to access care, it is from that pool that the insurer takes money from to cater for your need. So I need us to understand that. So for you as an enrollee, you are the one enjoying the insurance, not really the insurer. Now, if there's one thing that we have against us in the public sector, we struggle against a lot of factors in Nigeria. Yes, there's poverty, but spiritually, we hear a lot of So we're also struggling with the blood of Jesus. The blood of Jesus is a big competitor in this business, because when you're preaching insurance to people, they tell you I'm covered by the blood of Jesus. I don't need insurance, right? So whether you are covered or not, somehow you will need insurance, because insurance is in case. Don't forget, in case. Whether you pray for money tonight, at least we are in Nigeria. There's no how you will not treat malaria in a year. There is no how. So that's that. So to quickly talk about businesses, why businesses or business owners, entrepreneurs, why they should key into health insurance. It gives you a competitive edge in hiring, right? So of course, health benefits attract top talents in the tight job markets, right? For SME entrepreneurs and what have you, you are already in a competitive market, and you are looking for top talent. Don't forget, most of these SMEs, what they pay, some of them are still startups. They might not be able to compete with the guys in the big league. So you also want to get top talent, because you want to get the best out of whatever services or product that you are rendering, right? So health insurance, giving your staff health insurance gives you that competitive edge. Let me share this. I have a friend currently, he earns below 100,000. And every time I ask him, "Oga, why are you doing this to yourself?" He says, "Oga, this job that I have, why I'm still on this job is my employer have signed me up to a particular HMO, and I enjoy the best healthcare." I said, wow, okay. That's the reason why he's still taking that amount of money, and that's why he's still on the job. I'm like, wow, that's that he knows his family size. He knows that anytime he wants to give, the wife wants to give birth, is always through cesarean section or what have you. So having this job is good for him. Yes, he's going to double his hustle, but because he gets the best health care, he goes to the best hospital here in Abuja. That's the reason why he's on this job. So you see how it gives you a competitive edge in hiring as an entrepreneur. We look at another point. It also helps to boost productivity, right? Of course, productivity is key in every business. If I work for somebody, for instance, and I know I have health insurance, when I'm ill, the insurance take care of me, right? My office have already signed me up. I mean, to boost my productivity. But when I know that every time that I fall ill, I have to spend out of pocket and all that, every day I can even sit in my office and be using their laptop to look for jobs. Oh yes, people do that a lot. So as a business owner, it's good to sign up your staff, for health insurance, so that it helps boost their productivity. What about employee morale? It's almost the same thing with boosting productivity, right? Because it also shows that you care. These are the little things that matter. It shows that you care. So there's this big bakery here in Abuja, and of course, I'm friends with the owner of the place. So, and she kept complaining about how she's beginning to have so many turnover in terms of employee and all that, how it's affecting her business. Like, madam, have you bought health insurance for these people? No, health insurance is too expensive. I said, no, in Wella Health, we have affordable health plans that can be tailored for your business need. So what we did, I was able to help her. We got them, enrolled. We sign up all our staff. There is no time we don't get call from them, right? That's from when we sign them up. So they're always calling, "Oh, I'm not feeling well. Oh, this and that. I need to go and treat malaria. I need to treat typhoid." Of course, our standard practice is you have to, because we don't work with hospitals, we work with community pharmacies. Okay, so we need to connect you with one of our doctors. You do telemedicine through telemedicine services, right? So we'll telediagnose you and all that, then send you to one of our partner pharmacy closest to you, where you run a couple of tests. If the result is positive, they give you the medication that has been prescribed. So that's what we kept doing for our staff. And before you know it, everything turned around because she didn't have to be hiring new people every now and then. Because I mean, the guys that were working for her, they were happy that Madam cares about our health. So we don't have to pay a dime. Madam have already paid. It's just to call Wella Health. When we call Wella Health to get our drugs, even when we are sick this month, we'll call them. We are sick the following month, we call them. Anytime we are sick, we call them and we get our drugs. So that boosted the morale of our workforce. And she's somebody that doesn't play with her subscription. Before her subscription expires, she has paid up immediately, right? It's also a financial benefit for them. I said this earlier. That's for the staff. Because you don't have to pay out of pocket all the time. Hey, have we been to the pharmacy recently? Have you checked how much it costs to buy malaria drugs? Or how much it costs to treat typhoid? You would see that buying a health plan, well, for the one that we sell at Wella Health, it's a lifesaver, right? So even if you're not buying from us, if you are signing up with NHIS, which I strongly advise you do because they have more comprehensive health plan, right? And every other HMO, right? Which is fantastic. It will still save you money. At least it will reduce your out-of-pocket spending. Out-of-pocket spending is very expensive because you feel, no, I don't fall sick all the time. What do I need insurance for? Don't forget, insurance is for in case. And trust me, in case will happen. And when it does happen, that is when you will appreciate your insurance plan. Right? That's when you appreciate your insurance plan. So quickly again, one of my friends that got married recently, I told him, oh boy, now that you have tied the knots, just go and sign up with NHIS. They have comprehensive health plan. Right? Our plans are just, they are affordable health plans for more like micro health insurance plan that addresses, common illnesses here and there, malaria, typhoid, and all that. But the one for NHIS, comprehensive, and it's more affordable. Like my Oga said earlier, government pays huge subsidy. That's why it's affordable. It's not because it's cheap, right? The word affordable and quality healthcare, you can't find them in the same statements when it comes to healthcare. Affordable and quality, no. Anything that is quality, it cannot be affordable. But because somebody somewhere is paying that subsidy, so you can have both words in one sentence: affordable and quality healthcare, right? So okay, I've touched on quite a lot. So I'm going to speak a bit about our process at Wella Health. Like I said, we are a health tech company that is leveraging technology to ensure that we get healthcare across to every Nigerian and every African by extension, right? So we have an extensive network of pharmacies. We have over 3,000 community pharmacies registered on the Wella Health portal as I speak currently. Now, we use these pharmacies to service and release of top HMOs currently in Nigeria. Any HMO you want to think about, the top HMOs in Nigeria, we use these community pharmacies to service their release. This is how it works. They send us their prescription. We use our network of pharmacies to source for the medication and have the medication delivered to the enrollee, or we instruct the enrollee to go to a nearby pharmacy. For instance, if you reach out to, if you are one of these, if you're an enrollee with one of these HMOs and they send us your prescription, first off, we have to look at your address. If your address is in, which area do I know in Lagos very well now? Okay, I think I know Fadeyi. Let's say you are in Fadeyi, right? And you live on Isaac John Street in Fadeyi in Lagos. So what our staff will do, our customer success agents, they will look for a network pharmacy, a partner pharmacy on Isaac John Street. If it's not on Isaac John Street, a place that is close to Isaac John that would require you to just walk there, right? So if the pharmacy is not on our network, we will quickly onboard the pharmacy onto our network, pay them, So we just tell them, really, please go and pick your drug. So you don't have to stress yourself, walking up and down looking for where to go get your drug. We instruct them on where to go get their drug. And that has really helped us, right? And it has really kept all our partner HMOs, because they like what we do, and our business model has been something that or has been one that has really helped them to scale their business big time. We also have partnership with telcos, MTN, for instance. When you open your MTN app, you'll see the Wella Health icon there. You can buy any of our plans through there. We also have partnership with what is called Zoe. So it's also embedded. I think Zoe is embedded with Airtel. When you buy their data, a part of the money that you are using to buy your data will be used to pay for a health plan for you. So you see that it's a two-in-one thing. You are buying data, and you are getting a healthcare plan. Yeah, a micro healthcare plan that you can use at any time, any place in Nigeria. Our partner pharmacies are cut across the 36 states, including the FCT, makes it 37 states of the Federation. So that's what makes our business model unique. So in closing, I would say business owners, small and medium scale enterprise entrepreneurs, if you want to put it that way, signing up your staff for health insurance, it's a must. Please, you have to do it. Even if you have 1 staff, 2 staff, 3, 4, please sign them up, right? Else, you'll be getting calls from the members of staff, right? Every blessed day that, Oga, I'm not feeling well, Oga, I can't come to work. Oga, it's raining season. I fell down in one ditch. But when you have health plan for them, they can't call you that, Oga, I'm not feeling well. Oga, I'm calling in sick. I'm having malaria. No, because they know when they're having malaria, they know you have already signed up health plans for them. So you're supposed to call, to assess health care. So again, you can still get back to us to get the report, to know if truly if your staff reached out to assess, their health plan. So it helps, and it also helps you, like I said earlier, to boost the morale of your staff. You might not be paying them too much, but for them to know that you care about their health, it goes a long way. I think at this point, I'll take questions, if there's any. Thank you.
Thank you so much, Julius. Thank you for going through that extensively, and that's covered quite a lot as to why entrepreneurs should get the healthcare insurance, and telling us also how Wella Health works. And just before we start taking questions, I would like to go back to Mr. Ajibola now, because he was telling us something about the insurance packages that NHIS has, and and then we're going to summarize this together and then take questions that may be for both parties. All right, sir. So, Mr. Ajibola, over to you, sir. You stopped at the point where you were talking about the 115,000 for like 3 people. I think that was around the place where we lost you. And then now having to wait for 6 months. So talking about some of the ways you've addressed the adverse selection challenge. Thank you.
Hello, can you hear me?
Yes, we can hear you clearly. Yes, sir.
Yeah. Yeah, I was at that stage where I was explaining adverse selection. Now, at this stage, I want to say that federal government has done a very wonderful job in ensuring that health insurance is actually not designed for certain categories of people, but for every Nigerian. And let me also bring in here that even coppers are also being covered. And that started under the late President Muhammadu Buhari, that every copper has to be covered. This is an idea just to expand our coverage. And like Mr. Julius rightly said, our program is highly affordable. Not only that is affordable, it is also qualitative. And like he said, somebody somewhere is actually paying for it. And federal government is paying for it, and they are still willing to do more. Presently, as we speak, a lot of programs are going on the net to ensure that our services are improved, like I said earlier, to also ensure that drugs are available in all our facilities. And let me say here that not all hospitals are under our program. We have a team of enforcement, a team of personnel that are in our enforcement unit that go out on quarterly basis to accredit our facilities to ensure that they are well equipped to participate under our program.
Okay. Okay. Sorry about that again. I think his network has gone off once again. Okay, please continue, sir. We are with you now. Thank you.
Okay. I'm talking about the comprehensiveness of our program. Our program is comprehensive compared to any other programs of HMOs. I'm not here to run down any HMO, but I'm saying what I know, which a lot of us also know. And it is so because federal government is actually subsidizing heavily on behalf of Nigerians. That's why it's a bit it's more comprehensive than those of other HMOs. So I want to implore everyone that's on this program and those that are also around you. Our program is comprehensive, it is qualitative, and it is affordable. Now, talking about healthcare facilities, you are also at liberty to choose any healthcare facility of your choice. We don't enforce facilities on enrollees. And apart from this, we have call centers that if at the point of assessing care, there are issues at the hospitals. For instance, you might be asked to make some payments that are arbitrary, that you don't really understand. You are free to contact our office. And we always advise enrollees, before you make any payment that you are not sure of, try and get in touch with us. Because before that payment is made, it will be easy to clarify and tell you that that money is not meant to be paid. You are not supposed to pay this. Fine, if eventually you make that payment and eventually you still get in touch with us and we find out that that money is not meant to be paid, we still go out there and get to refund, but it won't be immediate and it also require a lot of effort. So you'll be saving us a lot of energy and time by informing us earlier if any suspicious case comes up at the hospital that, oh, I'm being told to do this or to pay for this test or to pay for this drug. I want to find out, am I ready to pay? At that point, it will be easier for us to come in and say, oh, don't pay or pay. There are cases whereby we have refunded, hospitals have refunded
Okay. Mm.
mentioning three categories or three levels of care: primary level of care, secondary level of care, and tertiary level of care. Now, this primary level of care is the very early, the lowest level of care that takes you to the hospital. Talking about the malaria, fever, typhoid, and so on and so forth. these cases that is beyond your primary hospital, it is dependent. It is important. In fact, it is on the onus. It left the prime facility has no option than to refer you to the secondary facility. That is, they don't have resources to handle a particular case. They can refer you. In fact, they must refer you to a secondary facility. That is where HMO comes in, Health Maintenance Organization. HMO is like a intermediary between NHI and between enrollees and NHI. Your facility will get in touch with your HMO. At the point of registration, you'll be assigned a certain HMO. We have a lot of them. We have Police HMO, Total Health Trust, Non-Such, we have International Healthcare, Healthcare International, and so on and so forth. Now, these are the HMOs that will give your facility a referral code. With that, they will refer you to a secondary facility for a secondary care. If at that stage, your case can still not be handled, you will be referred to a tertiary level of care. So these are 3 levels of care that you have access to under NHIA. And quickly, I want to talk about renewal here. Our program is renewal, and we always advise people to renew 3 months before the current program expires. And the reason for this is that
All right. This network is really giving us a tough time.
so it's all
Yes, sir. I think maybe we can hear you back now, but maybe you could just wrap up and send us the e-brochure. But we've been hearing you for the most part. But you were just talking about the renewing 3 months before. So, but it's still breaking, but we can hear you. But I think it's helpful, to send the brochure. Thank you.
okay. Now, before the end of this, I will send the one that I have is just a page, and it is containing our benefit package. And apart from that, it also contains what we call partial exclusion and total exclusion. And let me quickly explain that. Partial exclusion are those programs that you cover partially. For instance, cases that require high and advanced investigations like MRI scan and CT scan. In this case, there is a co-insurance method that is introduced. That is, the total cost of this will be borne by both the enrollee and the HMO through NHIA on 50-50 basis. If, for instance, the total cost of MRI scan is 100,000 naira, the enrollee will pay 50,000 naira, while HMO will pay the remaining 50,000 naira. That is under partial exclusion. Under total exclusion, these are cases that we don't cover at all. These cases, we don't cover them. And the reason why we don't cover them is simply because they are not really common in these parts of the world. And we don't cover them. Cases like injuries arising from it escapes my memory. But these are rare cases that don't happen often in this part of the world. So I will drop the brochure like you said before the end of the section. Thank you.
Yeah.
All right, thank you so much. I was speaking but I was not muted. So sorry. So thank you so much, sir. I think that was definitely very enlightening, and it would be even much more helpful to have the brochure, which you have mentioned. That we're going to share it with the email of everyone who has registered for this program. Thank you so much. Thank you, BC, for the virtual clubs. Thank you, Moyoluwa, for all the encouragement you have been giving so far. All right. So at this point, please, do we have any questions? Which is going to be the last thing we do before our spin to know the winners of our free health insurance plans. So okay, so I know I saw a question here earlier on, which I think has been answered already, and most of the questions also on my end has been answered. Also, because of time, I wouldn't want to go back to any of the questions on my own end. All right. So Adegun Miracle asks that, is this insurance acceptable at all hospitals or selected hospitals in Nigeria? And I think that question has been answered by both parties already. Mr. Ajibola mentioned that there are some hospitals that are not enrolled, that they have not enrolled in the program because they have to go and accredit them, and if they do not meet the requirements, then they don't use them. And then Julius also mentioned that they work with pharmacy partners, they do not work with hospitals. So you have to use telemedicine, and then when they have consulted, when you've consulted virtually, then you can get your medication at a pharmacy. And I want to believe that there's also a delivery option. So if you do not want to walk to the pharmacy to pick up your drugs, the pharmacy can also send it to you. But to say that there are HMOs that have different tiers of hospitals, so you have tier 1, tier 2, tier 3, and maybe one up to tier 4. I mean, you can't put hospitals just down the road on your street. I don't know where you live, right? And Redditing or Evercare on the same level, right? So there are different tiers of hospitals depending on how much you have paid. So it's going to know which how much or which hospital you can use. Okay, so is there any other person with any other questions generally? Okay, Damilola was commenting about reducing bandwidth by switching off video. Okay, true, that could have helped, Damilola. Thank you for mentioning that. Okay, so in case you have any other question, please I'll also quickly check YouTube to see if we have any questions from there. But in case we do not, let me quickly view this. Any questions? I'm not seeing questions on YouTube. All right. So please, in case you have any further questions, you can kindly reach out to us on you can comment under the flyers of this program that we posted online, and your questions would be attended to. Thank you so much, everyone. So I'll be handing this over to Taiwo now to go ahead with the free health plan spin. Thank you, Julius. Thank you, Tajibola. Can you please give them a round of applause, please, virtual? Thank you, Blessing. We can see your class. Thank you. Yeah. All right, Taiwo, over to you. Taiwo, are you there? You are muted in case you are speaking. We can't hear you. Hi, Taiwo. Okay.
Can you hear me now?
Yeah, we can hear you now.
All right. Thank you. All right. So I said, sorry, I didn't know about that. So thank you, Mr. Ajibola, for this section. I'm Mr. Julius. I really appreciate that. And I want to ask one question from Mr. Ajibola for clarity before we move to the before he leaves and before we move to the spinning session. You mentioned about the price, that the price have increased from 66,000 for 110. And you mentioned that for 110, 3 people can have access to it. Does that mean that they have to pay 110, 3 people can work on that 110, or they individually pay 110 each?
Thank you very much for that question. Am I audible? Hello?
Yes, you are. Yes, you are. Yes, you are.
Yes, sir. Yes, sir.
Okay. Okay. Now, a lot of people
Okay.
can
We
decide
can't
to
hear
do it
you.
alone, paying that same amount.
Okay, we can hear you now.
Can you hear me now?
Yes, sir.
You can hear me now. Okay, thank you. Now that program is designed for one person, individual. The person can do it alone, and the person will have to pay that same amount, 160,000 naira, plus data charges, approximately 117,000 naira. Now, what many people do, which is not actually the best, the best practice, though we sometimes we ignore for the sake of ensuring that more people are covered, is that once they are aware of that program, they go out there and get in two more people. They now divide the money into three. Now, the reason why we don't actually encourage this is because when they are about to renew, we always experience problem at this point of renewal, because two people that you bring together at that point of renewal, they may not have money to contribute again. The person will now be left with problems of looking for money, and one person cannot just come in and pay 38,000 or 39,000 naira and be registered. But if three people come together and they break the money among themselves, it will amount to 38,000 something. So that makes it easier for them to put the resources together to make it up to that 160,000 naira and register for that individual. But we always advise that if you want to bring in more people, let it be those that you know very well, that at the point of renewal, they will have money to also pay for that, so that the renewal process can be seamless. So the money is actually meant for one person, but people usually come together and
All right, sir. We can't hear you again, and we'll just move on to the next because of our time. Thank you so much, sir. All right. Kamale, please check your message. I need to have sharing permission for this. All right. We are going to spin our winners, three of our winners now, and we are going to use the registration link that we had a registration link out there, and we are going to use that to select our winners. So if you have anyone, once we call the person's name and the person is not here, we might just have to what's the word now, forfeit that person. The person will actually have
Move
to
on.
forfeit
Give it to
that
someone else.
particular. Thank you. All right, so also please follow us on our especially Instagram pages, very important. Please follow Quotidian-V Food, follow Cardinal Health Insurance, please. If you can follow Wella Health, please do that. Please follow us on our Instagram page. This is very important to us, and that is the way you can follow us. Thank you, and we like that. Thank you so much for for following. All right, so right about now, I'll share my screen. So it's a very fair selection. We don't know who the winner is. We don't know who is going to, who is going to experience this whatsoever. Right, let me see. Who is going to enjoy the benefits? Sorry, I was distracted a bit. All right, please confirm you can see my screen. All right.
Yes.
Thank you. I'm seeing the
Yes.
thumbs up. Thank you. So what we did, we had about 70 registrations, and we had to filter because this package is actually for entrepreneurs, business owners, freelancers. Okay. So we had to filter. First, we filtered off those who are government workers or corporate workers. So apologies, we had to filter them out. Then secondly, we filtered those who, so we had some people say, we asked the question that would you like to share about your wins on our pages. Some people said no, some people said yes. We had to filter that out too. So those who said no, we had to, filter them out. All right, so we were left with 32 people. I will be doing the spinning right about now. So we'll be doing the spinning right about now. So I have to, these are the list of the names that we have left, the 32 names. And we are using wheelofnames.com for this particular spinning. So it's a very fair selection. So now we are spinning our first winner. And it is rolling and rolling and rolling. Okay. All right, even my heart self, they do bing. So okay. Okay. Oh my gosh. So sorry. It's spinned, and now we have Oluwafemi Babalola. So do we have Oluwafemi Babalola on the call? Please, I have 10 seconds for this. Do you have Oluwafemi Babalola on the call? Yes, going. If she's on the call, please unmute. I guess she's not on the call, so we are spinning again.
Let me kindly check her name. Oluwafemi. No, she's not on the call. She's not on the call.
So I'm so sorry. The criteria is that you have to be on the call. So I'm so sorry about that. Next. Okay. Okay. Moyoluwa Elizabeth, please, are you on the call?
Yes, I'm on the call.
Moyoluwa Elizabeth, please.
Yes, good evening.
Oh, she has been so active this morning. She has been very active.
Your spirit was so active, and so
yeah,
congratulations, Moyoluwa Elizabeth. It's obvious that your spirit was just like, no, I have to win this this morning. You people must notice me. Even the spinner noticed you, and really, I'm so glad about that. So let's move on to our next person. This is no Ojoro anywhere. It's not any coding whatsoever. Nothing in the back at the back end. It's just a pure spinner that we got online and we are using. So next. Okay. Oduayo Victoria Ayomide, are you on the call? Oduayo Victoria Ayomide, are you on the call?
Oduayo Victoria. Let me
Oduayo
check.
Victoria.
No, she's not on the call. She's not on the call.
So we've done 3 spins. Tomile, please, what should we do? We're supposed to do 3 spins and we did 3 spins. So should we still go ahead and spin? Or
yes,
we should just go with our one
spin.
person? All right.
No, let's go ahead and spin.
Still, okay. Is still going to who? Oh, Marco Lusoya. So do we have Marco Lusoya on the call?
I'm on the call.
Oh, yes. On the call.
All right,
Congratulations.
Makolusaya. Congratulations, Makolusaya. Makolusaya,
Thank
congratulations.
you.
So
Thank
our
you.
last thing, our last thing, and before then, I'll shout out to our sponsors. Shout out to our sponsors. First of all, to my husband, Mr. John Kent Adebayo, for sponsoring. And so thank you. And we thank Cardinal Health Insurance as well. We thank Wella Health Insurance. I think I spoke about my mama the other time. My pastor. Have Adesola Ogunyebi. Are you on the call?
Yes, I am.
Adesola Ogunyebi. Are you on the call?
She's
All
there.
right.
Thank you.
Thank you so much. So we have our three winners:
you.
Moyoluwa, Elizabeth, Mark Olusoya, and Adesola Ogunyebi. So we'll get in touch with you and let you know the next step to this. So you'll be enjoying our free health insurance plan. We'll tell you the details after now, before the week runs out. So congratulations once again, and I'm glad that you were on the call. You can see this game is just, we had a lot of people who we've called their names, and at the same time they were not on the call. If they were on the call, they will have, they will have given those on the call options to, the good alternative. And so thank you very much for joining once again. We really appreciate you. So over to you, Komile. Thank you.
All right. Thank you so much, Taiwo, for that. And thank you once again to all our sponsors. We appreciate. God bless you. And thank you. So let me do the shout out and big thank you to our speakers today. I think I, as a person, I needed this session. So it was not just from the point of teaching or creating awareness, which is something I love to do, but I really also needed to understand more about the plans available. Sometimes last year I was going to get healthcare insurance for some of my staff, and I was scared. It was still kind of affordable around that time. What was supposed to be 20-something thousand, by the time I was checking back this year to, like, let's say, get new plans, it was already at 50 something, and then I'm like, okay, like, where am I going to put that in the budget? So I know that it's something that a lot of people definitely need to learn, and myself and my team, we have learned a lot from this. So thank you so much, Mr. Julius and Mr. Jibola, for joining us. Thank you for shedding the light on that. And to summarize what they have shared with us, please, we intentionally brought these two organizations, public and private, because the public, like they mentioned, they work with hospitals, right? And they have extensive plans. So in case you want to work into hospitals, the normal NHIS plan. And it's not just for government workers. You can also go and buy NHIS plan for yourself and for your employees. And if you're an employer, like Mr. Ajibola said, right? 3 people getting one plan. If you're an employer, I don't think getting people to pay during renewal is going to be an issue for you. So you might as well want to just consider things like that alternative, right? And you also have the more extensive ones for students, freelancers. You need to get yourself a package, maybe not the 115,000 own. There's one that I said it moves to 60 something thousand. So please get it for yourself. And then we also had Wella Health, which is not the contemporary insurance that most of us are aware about, and that was also intentional, right? For people who might not be able to afford extensive healthcare insurance, health micro insurance is an alternative for you. And Julius explained how they work with through telemedicine and with pharmacy networks across the country. So I know part of their packages, they have things as cheap as 8,000 naira per year. Is part of their packages. Yes, with just 8,000 naira in 1 year, you can access healthcare for up to 3 times when you are sick. Speak to a doctor and get your medications. And if you are paying the more expensive one, like the 27,000 one, I know you'll be able to access healthcare at least once in 30 days, right? So health insurance is not expensive. That's the idea. health insurance is not too expensive. Whether you are getting the 8,000 own, the 20 something thousand own, the 60 something thousand own, the 115,000 own, or for any other insurance companies, please just make sure that you give yourself a treat. And I'm also saying that start giving health insurance as birthday gifts. In case you are beginning to wonder, what can I give to your friends' network? Please start giving it as birthday gifts. Imagine giving that your niece that is currently not covered. Maybe you have a niece that the mom does not have an HMO for. You can just buy her the 8,000 naira package. Or you have a friend that you know this friend is an entrepreneur, right? Self-employed, does not have health insurance. You can choose to just say, okay, I'm going to give you the first tier plan of 27,000. It is something you should do. So please start learning to gift healthcare insurance as birthday gifts. So Christmas is coming as well. Let me also use this one to opportunity to appeal that gift your parents health insurance as Christmas. In case you are wondering what to give your parents health insurance as Christmas. They would love it. I can tell you that they would love it. And then also, when you are going to motherless babies home, when you are going to, don't just drop food items at motherless babies home. This is also a public advocacy to say consider buying HMOs, even if it's like consider buying HMOs, even if the 8,000 one from Wella Health, right, and the likes. Buy it for children in the motherless babies home. Buy it as empowerment programs. So like think beyond corporate employment. When you think health insurance, start thinking it as a commodity, a consumable, day-to-day consumable. And I'm definitely certain that people would appreciate it. So follow us as Cardinal Healthcare Foundation for more information about how you can access healthcare insurance and how affordable they are. And just to tell you a little about the organization, we are a non-governmental organization. I know Taiwo said Cardinal Health Insurance. No, we are not insurance company. Cardinal Healthcare Foundation is a non-governmental organization focused on providing primary health care to low-income earners in Nigeria. And we work in both rural communities and urban communities, but most of our clinic efforts are focused in rural communities, while our public health efforts cut across every aspect of the of healthcare, not just of the country, not just in rural areas. We strengthen hospitals in terms of by partnering for medical oxygen access, for partnering for vaccination programs, and partnering on literally any public health work that can improve healthcare access at primary and advanced levels. So once again, my name is Momile Idaresidogunjemite. Thank you, Taiwo, my friend, for joining this session. Thank you, Mr. Julius. Please let's give another round of applause. Thank you, Mr. Jibola. Thank you so much. I loved your storytelling and details, like so detailed. And I can tell you that definitely people are going to show up because of your contribution. Regularly we host live sessions. I host several live sessions on different topics, from health insurance to preventable cancers to healthcare systems. So kindly subscribe to this my YouTube channel. This video is also streaming, and please watch out for other videos if you are looking to learn public health or related, learn more about healthcare generally. Please kindly make sure that you follow myself and you check the YouTube page where we are live streaming. And I hope to see you again on other programs. Bye. Okay, I think one final thing. Sorry, please, in case you did not win, this one is an announcement. In case you did not win and you want to get health insurance and you are still confused as to how you can get it, so please kindly reach out to the email that was sent to you, or reach out to us in DM. And this is because there are some packages to maybe you are looking at group, you are for, especially if you have a staff and you are still not clear, please kindly reach out if you're interested in for yourself or for your companies and you do not know how to, or you are looking to create a group effort to be able to do it. Then we might be able to move you forward from there. So catch ya, see ya later. Bye. Thank you.